Did you grab the coffee? Great. Please find your seats. Now we move on to the third and last part of the seminar. And here we would like to, or we will be explored for some use case examples. And then we will start elaborating around specific initiatives. How can we move this forward? And the first one out is Naveen, and you will talk about the use case of IOTA.
Oh yeah.
Thank you.
No, a few, lots of things.
Okay, lots of things.
So these are the different things I do professionally as a doctor. So radiology, lecturer at Health Informatics at UCL, co-founder of Open Cancer with Peach, which are two IT initiatives, prostate cancer informatics in the UK, in the Health Information Collaborative, and UCL Centre for Blockchain Technology. So a few different things. I've come at it from a few different angles, and the question is, how do I get into blockchain? But before I get in there, there's one thing that keeps coming up again and again, and everyone goes, oh, we're a bit too late to be doing this in Norway. Are we a long way behind? The answer is no. Lots of things I've been to, people talk a lot about blockchain, they haven't done anything. And most of the things that they've done seem pointless, and there's no real use for the blockchain. Where you have a massive advantages in something called OpenEHR, which, has anyone heard of OpenEHR? Ah, good. That's it, because that's, I think Björn talked about it last time around, the flat way that the data is stored and how you reuse that. Can you understand that meaning of the data and use it in another system very easily? Most places don't use that. So America, which is very bullish, and they're like, we're the best at this, nothing. You can't move anything from one hospital to the other. You guys are the only people in the world to have a national archetyping institute. So they actually lead the international work on modeling that data, and I'm part of that group. So having that, I think, is a very, very good base. That is the difficult bit, which you need, and you've got that already. One pattern here. Oh, that's the wrong button. So this is the basis of everything. Data is currency. We have all these operational systems that generate data, and then what happens is people go, well, I want to get some meaning out of it, and so they start building analytic systems. So some for business intelligence, to tell us how many people have this disease, how much resources do I have to put here, what's this patient's pathway like, and other people build anonymized research systems. And they put lots of money into 3 different bits, which are all kind of complementary, but they're completely separate to each other, and the money gets wasted. So for the last few years, I've been trying to bring them all together, and I've been trying that at UCH, but because we're not as advanced in OpenEHR, it's pretty hard. So Open Cancer, I started initially to look at how you do that modeling of cancer data in OpenEHR. And so we've been doing a lot of work there, and the group we're working with worked with the National Archetyping Unit here to do that. So we already interoperate in that way. Peach is an association I have with UCL Computer Sciences, so there's about 40 computer science students building lots of these different systems for healthcare, which should hopefully, they're all open source and they can be reused here. And this is, I think, what we want, I want the future model to be. Lots of different systems in one hospital. So pretend this is one hospital. Suck it out with an extraction mechanism, put it into an open air database. So this is how we're going to achieve that kind of spread information model in my take on it. The great thing about OpenEHR, you separate the demographics, so it already becomes pseudonymized here. So the two are separate from each other. And then you can do business intelligence and research on there, or you can add new data straight into OpenEHR if your system allows. And the advantage next is I can copy just this blue box across to a research institute, and I've already got an anonymized data set without doing anything. And that can be updated real time. So you can do real-time data research on that. If I take that blue box, I can send that off to regional bodies that can start doing research or registries. Next, if I take a blue box at every site, so these are different sites. So this is from a slides I made from a talk about 3 years ago, talking about this. So this is different units, different hospitals in North London. So each box like this, the way OpenEHR works, I can send distributed queries to it. So the data can sit exactly where it is. I can send one query to each of these and get back the same kind of answer, and use that to make health analytics, pathway management, social care systems, plug into the community hospital, the GP, general practitioners. And the final take on this, and this is what we're leading towards right at the end, is this. In the UK, if you have these blue boxes everywhere, instead of having a registry that asks for anonymized data, you keep the data where it is, and you say, okay, how do I, if I want to know how many people have cancer, prostate cancer, I'll just send a query out and I'll get the answer back. The problem with anonymized registries, which you have, is that if I send you all my data about prostate cancer and all my data about lung cancer, it's anonymized. So you don't know that one person has both prostate cancer and lung cancer. So you have to link them back together, which is very, very expensive. Whereas here, it's already linked at source. You just send the queries out to it. That's the idea I had, but the problem is when we have these distributed databases, how do you secure that data and make sure it's accurate? And that's where I got into the blockchain space. And so Will asked me to sketch this out, so I got my Adobe Illustrator out and I said, okay, I'll draw this. And this is where I think it should work. So this is the way I think it should work. So healthcare providers, and actually why stop at healthcare providers, anything government-led. So public services, all of them feed into a big bank of data where you have this ledger at the top which controls the distribution, exactly like in Poland, where this doesn't store the data, it's just an index of where the data is. So you have, I'll put IOTA in there because I'm biased, and I'll tell you why at the end. You have identity management, so you know where everyone is, and you have the access and consent management. So everything is stored here on who's allowed to access what and who's consented to see everything. And you separate the data to live in a distributed space. So it's not controlled centrally. You live out in the cloud. Something there was not let you deal with that. But the next question, as we've said, is sorry.
Two quick questions.
Yes, go.
In Norway, we have a personal identifier.
Yes.
A unique personal identifier, and we have unique identifiers for businesses or all legal entities.
Is that the bank ID thing?
No, bank ID is just an authentication mechanism.
Yes.
Well, we have something called ANS register, which is a registration of that authoritative registry for all legal entities in Norway.
Yes.
And we have a registry for individuals, residents of Norway, and health personnel and so on and so forth.
Okay.
How does blockchain and what you're describing play out when you have trust registries?
I'll get to that at the end. So there's a specific thing specifically about that and an initiative going on. When we're talking about the billions of devices, so Will has been trying to set up a startup called Pillar, which is based on IOTA, specifically around using distributed ledgers in health. And one of our first use cases is securing IoT devices, because the thing is, if you're trying to secure data, things generated from EHRs, hospital systems, are very infrequent. IoT devices can make data every second, every millisecond. How do you secure those streams of data? We'll get to that in a minute. And our proof of concept starts with how you monitor patients at home with the IoT devices, and also get user-generated feedback like patient-related outcome measures, prompts. So we've been working with UCL, AHO. This relates to some of the stuff you were talking about in that will it start automatically? No, it won't. How do I start that? So this is just a quick thing of how do you monitor, how do patients control who accesses what? Very early work. We started thinking about how you group different kinds of data together so you can share it easier. But the reality is exactly like you said, it's all about patient education. Some people want it very granular. I don't want this person to see one thing. Other people will just want it really easy and say, yeah, I just want to share everything. So that will not come easy, and we know that. But we're trying to involve multiple parties. So is it AHO? Can you describe it?
Yeah, I think Musa is probably
Aha!
here.
Hello! Hello. So what we're trying to do in this initiative is to get everyone involved in this, because no one big company, no, we're not going to be like, it's not like Google or Apple saying, yeah, we do it this way. I think this has to be a community-driven effort to make it work for everyone.
But you can maybe, Musa, if you can just mention your organization and
My name is Natasha Piji
end quickly. It's a long debate, but everyone needs to be involved. But on that term, here's another thing. So I'm doing some work with Digital Capital in London, who will be coming here next, and that's about GDPR and the personal data receipt. So if an institution owns some data about you, you need to know what it is and what it means to you. And that's half to do with the technology, half to do with like imagery, language, everything like that, which will be different in every country. But you've got to have that debate, because if your citizens aren't educated about it, they won't know what's happening to them. So empower them to do the right thing. What's this? The connected healthcare we've kind of touched. The one on the left talks to the question at the back. I don't know who that is. Gentleman at the back? You're talking about how you do identity management. So this is something called the Decentralized Identity Foundation. It was set up about a month ago in New York. So IOTA is part of one of them. There's about 25 founding members. Microsoft is another. Accenture, IDEO, GEM, Tyrion. So there's about 25 different people looking at, 25 groups, looking at how you start doing not just identity of people, but organizations, things, and you do it at scale. Because the way we currently do it is to have a trusted person overseeing it. When we have billions, even trillions of devices and things and organizations, you just can't rely on that. And you've got to have a different way of approaching it, something that's more scalable. Early, but everything we're talking about here is early. One last thing, I'm nearly done. The recap of the problems with traditional blockchain. We haven't talked about it. We kind of touched upon it, but this is IOTA, is what I like. Why do I like it? We keep saying, oh, Bitcoin's great, Ethereum's great. Well, okay, let's look at it. How quick is it? Bitcoin, the maximum it can do is 7 transactions a second in the world. That's it. So 7 things can happen simultaneously in the world. If we're trying to store data on it, that doesn't work. Even with money moving at the minute, I've tried to move money, it takes a couple of days to move. Ethereum, which is quicker, people go, oh, that's going to be the answer. No, it does a maximum of 20 transactions a second in the world at any one time. And the reality is it's hitting about 3 to 4 transactions a second. Not scalable. How much is the cost of doing this? So the way the other things work is you pay a miner, someone who validates the transaction, some money to process the transaction. It started off as negligible. The current average on Bitcoin is $1.50. And that's fine if you're transferring $1,000. If you're trying to transfer a bit of data or $1 to buy a cup of coffee, never going to work. All-time high for Bitcoin, $10 to get a transaction processed within the next hour. That's what we're talking about. Ethereum ranges between 4 cents to about $3. So that's why we start to think about how do you do it without having to pay the miners, because there's a delay and also there's a cost. So the way it's done is that each one of these blocks is a transaction, and for it to happen, if I'm going to put a transaction on the system, I have to validate 2 other transactions. So instead of paying the miners, my payment is to validate 2 other things. So the more people that join on, the quicker it gets. Has anyone seen torrent files like BitTorrent? That's exactly how it works. The more people join the network, the quicker it gets. So rather than more people making it less efficient, more people makes it more efficient. And because you don't pay anyone, there's no transaction fees. So that's the way it works. So far it's been 2 years developed. Started in 2016 was the first transaction we did, and it's about $100 million worth of money has been moved across. And this was 182 was when I did this slide a while ago, that we've reached 300 and now 800 transactions a second, compared to 7 in Bitcoin. And the more we add, the quicker it should get. This is the foundation, these are the developers, that's David, and then that's me, looking younger, and we're looking younger as well. And so this is it, we're working with Microsoft Energy from Germany, Ubuntu, so Canonical who make that, on a few different things. I can tell you about that later, I won't now. This is the Distributed Identity Foundation looking at how we look at identity and consent management, and trying to set up an ecosystem here, hopefully. And there's a developer fund, so if anyone wants to build on top of this, there's now 2 million, it may have gone up to 10 million now. There you go. Yeah, it's 10. So if people want to build on top of it, you can apply for money to do that. Sorry, question?
So hi, I'm Sahil from a company called Githya.
Is it okay if we ask some questions along the way?
Yeah, I think I've finished now, and she may want me off.
The challenge is the time, but
Yeah.
very short question and very short answer. That means that you have 7 seconds.
What's your estimate of number of transactions per second needed to handle the load of all these IoTs being connected?
In the world, we're talking about billions of transactions a
Per
second.
second.
Yeah, if you're gonna have billion devices out there, and some of them are making one thingy a second, yeah.
What's your thought on how you achieve critical mass for the network to grow large enough to go?
Yeah, so with all of this, there has to be the problem right now when it's early. It's very technical, and I'll answer that later. But right now, we need a central coordinator when the numbers are low. We can still hit those speeds. It's not completely decentralized. As it grows, we can decentralize it and remove the coordinator. But I can chat to you about that later.
Okay. Short question there, and then you are up here presenting.
Yeah.
Yeah.
What is the role of this foundation actually? Who are there? Where is it established? Is it somehow
Yeah, so-
democratic organization?
Yes. That's a very good point. It's a not-for-profit organization. The main office is in Germany, which is one of the things, and the other office is actually in Oslo. So those are going to be the two main sites. It's non-for-profit. Everything's open source, so you can see it and you can audit it yourself. The aim is to push these technologies, and no, I don't get a salary. We don't get salaries, so you kind of do it because you believe in it.
That's a pity. You should get salary.
Okay. Thank you so much for that part, Navin. Now we move on to Antti. How do you pronounce your last name?
Poikola.
Yes, exactly. You are from Finland. You are working in an organization called Digital Health Revolution, and your speak is going to be about from GDPR to my data and the digital health revolution, and you also would like some questions. We agree that you will short it down and try to have some dialogue with the audience.
Yes, I skipped the GDPR part because that has been touched quite many times. So
perfect. We would like you to be here because then you will be in the stream. Here you go.
So that is good. Okay. Yes, I'm not from the Digital Health Revolution organization. That is a strategic research project in Finland that where I've been working as a researcher at Aalto University, and our research team has this vision of making the personal data management human-centric in the world, and I think quite many of here share the same vision as I do. And my slides are online, bit.ly/mydata-Oslo. And I didn't come by bike, but if you want to make a kind of image of me, I'm a cyclist, dreadlocks guy from Finland, and you might remember me of that. So I've been working for, or part of the Digital Health Revolution project. We did a white paper about my data for the Ministry of Transportation and Communications in Finland, and that was quite successful in a way that the idea of individuals being in control of their own data via that white paper and some external lobbying, it went to the government agenda in Finland, and it has been there now for a couple of years, and things are starting to move quite fast in Finland. And we published it also in English and started to get connections from all over the world, and people say, yeah, we have been thinking the same. So the idea is not originated from Finland, it's originated from the status quo of the world, which is not very good for the individual's perspective, how our data is managed nowadays. I have a message for you, or 4 messages. One is that the trusted sharing of personal data, it's definitely not a health-specific problem. So I'm going to kind of shake a little bit the health things now. This is the logo of what we have in the white paper and in the My Data conference, and it really tells the story that there is all sorts of data of us, all places. IoT data is here. This is maybe a bad logo for that, but that's one big chunk of our data. Then there is the education-related data, all kind of online courses, mobility data, electricity, utilities, government data from here and there, these self-measurement things, quantified self. Then there is the health, but there is also finance sector, digital DTL technology is strong there also. Retail chain, if I take my wallet, I have like 10 different loyalty cards there. You name it, mobile devices are tracking me all over the places. So this is the current status of personal data, and what we want is to put individual into the center. And that creates this potential that nowadays if somebody wants to, let's say a wellness startup wants to develop an application that somehow utilizes data from my devices and perhaps even this very strictly protected official health data. They need to go knock to the door of the Polar and say, please could we get access to your APIs, and then they need to go to knock to the doors of the hospitals or the national centralized data systems like what we have in Finland for health data. It's called the Kanta system, and usually these kind of negotiations are not easy at all. Because there may be not really big incentive for example, the National Health Organization to open APIs for the electronic health record systems or something like that. And the vision is that in the future, the app developer here may be like some dashboard that collects if I'm diabetic or I have some other chronic illness, I may have different data sources that are relevant for me, and that developer just asks me, hey, hello, Yogi, that's my nickname, could you please give access to your data from this and that places so that we can offer you the service. And that makes individual kind of the point of integration of their own data and also the point of control. I can decide yes or no depending what's the offering. So it's not health related, it's all personal data management goes kind of the same way. Of course there are some health data might be more sensitive, but also financial data is very sensitive, so it's not so specific. And then the question is that, okay, but we have these HL7 super complicated structures that need to be followed. So the semantics of data, whether somebody actually understands what if the app developer gets any sense of the data, that's kind of next level problem. Now we are talking about actually getting the access to the data. And I believe personally that the interoperability of data standards, they born out of the necessity. When there is really good use cases, then people start figuring out how to make the data actually understandable. Second thing is that I'm going to quickly tell about my data operator model and how it relates to distributed ledger technologies, and then quickly saying that what's happening in Finland and Estonia. We are really ramping up these my data operators, and I will be welcoming you in the end of August to Helsinki and Tallinn to my data conference. So this is the vision. Core idea is that individuals should be in control of their own data, and that brings two kind of axes. One axis is the data protection. There needs to be kind of digital human rights, that I'm protected and I have privacy and I have rights over my data. But the other axis is actually making the data value out of the data. And nowadays the value is done by the organizations. And I'm kind of counting when I see the presentations on the data economy, how many times there are ever in the slides the person or the individual. It's so often neglected. It's from the organization-centric thinking. It's so deep in our kind of way of thinking that, okay, let's collect this data here so that we can analyze and make new treatments or something like that. Individuals, we just need to get consent from them, and then we can get rid of them. That's kind of ugly way to say it, but too often we neglect the benefits for individuals about their own data. And these are the principles, so it's really human-centric I can decide what to do with my data. And then there are the usability. It needs to be in machine readable formats, APIs, and GDPR is actually having this Article 20 that forces organizations to give out the data in machine readable format. Nowadays it's not the case, but the key is here. Now it's really the power to do anything with the data remains there where the data is collected. It's, if I'm Google, I can do quite many things, but if I'm a startup from Norway, I might not be able to do so many things because I don't actually have the data. And we speak about AI. That's all about having the data you can give for the machine to learn. And if you don't have access to the data, you cannot do it. So this method of asking it from the individual allows that if you have a good product, you can convince people to buy your product, then you can have access to the data. So kind of makes the business ecosystem wider. So this is nowadays, everything is a mess. This is what is happening now, like in Finland, we build this Kanta system that all the health data comes together. And this is also what Google's and Facebook do. They become these hubs that connect many data from many sources. You have in your presentation that let's get access to these different hospitals' data. So kind of bringing it together and making it usable. That's really needed step, but still the individual is kind of neglected in the side of the picture, and we imagine that individual should have their own account, data account or health account or my data account, own tools to actually give those permissions to use his or her data. So I'm flesh and blood, so I cannot actually give the permissions. I need some sort of platform to do that, but it should be under my control. And we imagine that it's like phone operators, teleoperators, they connect our phone calls, and banks are our money operators, they connect our money transactions, so we could have these my data operators that connect our data transactions. And in the same way as in the, yeah, here it is. So my data operator, individual data sources, data using services. This is the ecosystem. And we don't want that there is only one data operator. We don't want that there is only one phone operator. It's magically that if I just take a phone and I have phone number of you in the front row, I can make a call, and there is a big probability that we have different phone operators, and it just magically connects. So this is the system that we want also for personal data connectivity, that there is no one single giant thing that connects everything. And that's maybe the problem in thinking in Finland and Norway and Estonia, these advanced Nordic small countries, where you can imagine doing something nationally, voila, it works. But if you go to Germany, UK, you start already, people don't even imagine doing anything nationally, and that's kind of healthy thing to do, because the world is global. It needs to scale up, and I'm just saying forget about the national things, and we are looking for interoperable models that can scale globally, and that's where we come to the distributed ledger technologies. So how do these operators, if I have I'm here connected to operator A, and then there is this health data provider, let's say this watch is connected to operator B, and the startup that makes the service is connected to operator C. How can these communicate together? They need some sort of shared resource, and that can be put into the distributed ledger, because if the shared resource would be kind of centrally controlled, they don't start trusting each other, then it's like, why should I connect to this thing that is controlled by the, let's say, Finnish government or this company X. So, yeah, just to recap, my data idea is in the Finnish government agenda. It says that people's right to decide about and monitor their personal information will be enhanced, and now what's going to happen quite soon, we have had this alliance of 40 companies in Finland thinking about these personal data, my data issues already for 1.5 years, and now we managed to kickstart a new project called TrustNet, which is the goal is to establish this distributed digital identity network where we can implement this My Data operator model in Finland and start first My Data operators, and also in Estonia they are planning similar kind of pilots, and in Finnish and Estonia share the same government level data sharing infrastructure called X-Road. So that's what's happening now, and my time is also welcome to Helsinki and Tallinn in the end of August.
Thank you so much for a great initiative. We, as you can see, we are a big group here today. We would very much like to send out information about the conference in Helsinki to everyone.
Would you like to have a discount code?
That would be perfect. I'm pretty
I
sure
can
that
give
everyone-
a 10% discount.
That would be excellent.
As a matter of fact, I just want to point out, you mentioned a few partners at the beginning of the slide, so I'll come back to it. But we'll actually join, so we'll take hopefully a delegation from Norway to attend the event.
Okay, that would be great. I think we move on. The questions is left for the lunchtime. I give you maximum 5 minutes. You have 2 initiatives that you would like to launch to the audience, and then I will spend 2 minutes wrapping up everything, and the lunch is a little bit after 12 o'clock. Go ahead.
So very quickly, to wrap up a bit the morning. In Norway, what we have done so far is to run some workshops that have scaled some degree to this event today. We've also delivered through Alpha Venturi, which is a company I manage, a report that is in the hands of the eHealth Directorate that was delivered to the Norwegian Research Center for eHealth. So the narrative that we described today is actually a bit in the hand of some of the authorities in Norway. They don't probably know yet what to do with it, so we are here to basically assess and demystify the technology. We've run some proof of concept, and then we're building this adventure as an ecosystem. But very quickly we see this is a cross-border adventure, and this is how we want to participate to doing it. We've matured the idea, very much inspired of my being last year at My Data in Helsinki. I think I was the only Norwegian. I'm not Norwegian actually, but I was from Norway, and I was like surprised. Oh my God, we have so much things to offer to this ecosystem. We're like super good in digital identity, authentication, and so on. So many things we can contribute to. We've learned from Navin that we're really good at open EHR when it comes to healthcare. So many things we can contribute. What we suggest is to actually create a digital sandbox. It's a My Data Health sandbox. We look at healthcare to begin with, but eventually what we see together with Antti is that this is a model that can be replicated in a lot of different sectors, much beyond healthcare. We want this to be an ecosystem where we can bring the authorities to collaborate with startups. We say it's a sandbox because maybe this may be a bit disruptive to legacy systems and old ways of thinking. So let's create an ecosystem where we can innovate together. It's an open innovation sandbox. And we'll, in the digital world, get access to real data. We combine patient-generated data from connected healthcare with EHR data, and we'll create some new innovation. And the idea is to focus on very specific problem worth solving, and we can discuss this all together about what should be those problems to solve. We really want this to be cross-border because then we really cut the silos, and we could do it together with Finland, and that's the discussion we're going to probably have continuing forward. The EU Commission also has been extremely interested in that. The pitch here is that this is a very agile way to create innovation, very different from research. It's very important that we are beyond research. We're going to build a bridge between applied research and the world of innovation. And that's the specificity. We need to be very agile moving forward. We'll take that message forward. We'll go to My Data. We'll talk around this together with our partners from Norway and Finland. And we'll also talk at the Innovation Week and other events. There's a very good match with Finland. We talked about it earlier. In Norway, to catalyze this, the IOTA Foundation has teamed up with different partners. Oslo Medtech, Oslo Cancer Cluster, and PNU CCIS, and the eHealth Research Center, as well as Alpha and Curie. This is the beginning of a network where we'll bring the research partners to contribute to innovation. Exponential technologies require us to get an open innovation cross-silo approach and accelerate the pace. We can't have 5 years research to nail this. Things are going much faster. But in Norway, we need to empower the research institution to participate to that. So that's what we're going to create together, to create a bridge between research and innovation. And IOTA will have a fairly inclusive approach to that. Maybe we're a bit biased because we have our own technology, but we also open source and we're non-profit. We work a lot on interoperability with other blockchains. So we will bring this ecosystem to mature and strengthen the capabilities in distributed ledgers in Norway. But beyond that, we want it to be not only related to healthcare, that's where we start, but this will be international as well. So we have a few partners that we're going to engage with to bring into that network. And hopefully that actually would be nice to actually have a nice story to build this DLT global network that has emerged from Norway. So it starts today, and some of you will join us this afternoon for a discussion. We'll explore some of the themes we discussed around connected healthcare, cross-silo data management, and we'll discuss again about this My Data Sandbox idea. Yes?
Excellent. Thank you, Wilfred. I would like to add, as a conclusion part here, that first of all, what have we learned? I mean, a lot of things, but is it a hype? I don't think so. Are we too late in Norway? Naveen says no. We are actually maybe, if we start doing things now, maybe not necessarily ahead, but we could do things. We have potential here in Norway, and it seems like this technology could be very useful in order to solve some of these challenges that we do have in healthcare, and also for empowering the patient as well. That's at least some of the takeoffs that I do have. I would like to say we have some actors in the audience today that could be very, very helpful, important as bringing this forward. I know that the Norwegian Research Council is here, Nordic Innovation is here. We have EU, have them on the internet and are connected with them as well. And I would like to invite everyone to actually take part in, if we call it a task force. This is the first step. This is the first meeting. Oslo Medtech would like all of you, and I think I can say on behalf of Oslo Cancer Cluster as well, and Gupta is doing like this, that we would like all of you that would like to be part of such a task force moving forward, because I think that this could be a lot of different projects. At the same time, sharing the knowledge about it, how to do it, etc., etc. That is useful. How many of you in the audience are representing a healthcare provider, hospital or municipality? Exactly. No one is actually representing the hospital or the municipality. Or how about the eHealth Directorate? Are they here? Yes, very well. Thank you. We will jump on you in the lunch and talk to you, or keep the dialogue, because we need to actually engage with the healthcare providers and also with those building the systems and helping, empowering the patients so that we can have access to our own data, among others. Yes, so I think that by that I would like all of you to, if you are registered on this seminar, hopefully we do have your email address.